I have never picked up this much cancer in my life in younger women.
Are you serious?
I actually am picking it up more in younger women than in older women.
Stop it. What's happening?
Your environment is a big proponent.
Right. Huge.
It's huge. So stress causes inflammation in your body and suppresses your immune system. So I think people are just way more
Too stressed.
It's the rat race. It's all about work. Go to the next meeting, go to the next. Being in that toxic masculine energy is not healthy.
Do you think that's a part of what's making women sick?
Welcome to Whole Plus, the podcast that embraces and tackles the holistic way, bringing it all together: science, research, innovations in technology, and our collective human experience. This is where science and spirit come together. I'm Dr. Taz, your host and a double board certified medical doctor, an integrative health expert, a nutritionist, and an acupuncturist. I'm also the founder and CEO of Whole Plus, a digital and clinical platform where my team and I practice evidence-based holistic medicine every single day. I know and I hear all the health and wellness noise that's out there. I want this show to be the one to empower you with the knowledge you need to heal not just your body, but your relationships, your communities, and our world. Welcome to Whole Plus.
If you've been watching and listening to the show, you know that we have had very heated discussions around breast health, how to screen for it, how to prevent and treat it. We've had experts on, and our inboxes are flooded. You guys have lots of questions around this, and I get it. I understand. It seems so confusing. Well, we're definitely not done talking about this, and that's why we invited Jasmine Khorsandi onto the show. Jasmine is an ultrasound sonographer and founder of SonoBreasts in Santa Monica, California. She takes a holistic approach to care and loves that she can provide women with radiation-free breast ultrasounds using the advanced SonoCiné. In her free time, she takes care of her mind, body, and spirit through a holistic approach using yoga and meditation. She enjoys traveling and trying new restaurants, and she believes that God gives everyone a gift, and if you give it the energy every day, it will manifest. Please join me in welcoming Jasmine to the show. Jasmine, I am thrilled to have you here, but I've got to give you some context. We have had a lot of very robust is probably a good word, discussions on this show about breast health and breast screening, what to do, when to do it, how to do it. There's been a lot of back and forth. I'll share some of the comments with you later. I'm so curious what you think. But before we jump into all things breast and how to take care of our breast and what should we be thinking about when it comes to our breast, tell us a little bit about how you got into the world of breast health, into SonoCiné. Give us a little bit of the backstory.
Okay, so around 13 years ago, I got hired by a holistic OBGYN straight out of school.
Oh, wow. Okay.
Yeah, so it was a great first job to have. Especially, I was like a sponge out of school. You know, you could have either gone the Western way or the holistic way. She was an MD, but she practiced super holistically.
Right.
And she was using the SonoCiné in her office.
Okay.
So her team trained me on how to use the SonoCiné, and I was extremely impressed because the technology is super thorough and it was picking up really, really small tumors the size of a sesame seed.
And it's SonoCiné, not SonoCiné. Because I hear a lot of people, including myself, we say
Yeah.
SonoCiné.
You could say
SonoCiné.
either.
Either way.
Either way.
Got it. All right. All right. So you're fresh out of ultrasound school,
Right.
right? You're now an ultrasonographer, and you
Yeah.
go straight into a holistic type situation there.
Yes,
Right?
it
Okay.
was straight into that. And the doctor was anti-mammograms. She was super holistic. She actually really was against it. So this is a technology she used in her office. And divinely, I was at the right place at the right time, and they trained me.
Amazing. And what, coming out of ultrasound school and then, probably you were trained to do breast ultrasounds, I'm guessing, and traditional ultrasounds, right?
Right.
Just sort of like when we're coming out of med school, we're in sort of a very conventional mindset. What were your first impressions of this new technology compared to what you had already been trained in?
So the regular technology, there was a lot of gaps. So we would, hold the transducer and just take a couple of pictures, and it's kind of like texting and driving,
Mm,
because we're the operator, we're holding the probe, and we just intuitively take, a couple pictures, one at 12, one at 3, one at
right.
6 and 9, the axilla, and that's it. But when I, put my hands on this robust machine and it was recording 3,000 images, and the 3,000 images were turning into a 3D movie, it was the creme de la creme of
Wow.
breast imaging. I wasn't guessing myself anymore. There wasn't questioning myself because it's doing the automation is like AI. It's doing it for you.
How long has this technology been available?
I think it's been around 15 to 20 years.
But why have we not heard about it before? I'm like, wait, why have we not heard about it before?
So Dr. Kelly is a genius. He's a breast radiologist.
Okay.
Him and his brother-in-law created this technology like in their garage. And he wasn't a businessman,
Right.
so he wasn't able to like spread it to the masses. He had his own clinic in Pasadena as the radiologist, just one-on-one with his clients. So
Okay.
he wasn't a businessman. Like most doctors, they're focused on their
Right.
patients and they don't have that business gap or
Time sometimes.
time.
Yeah.
So he just loved his patients and he had a clinic in Pasadena and he was super busy, and him and his team trained me
To do this on
to do
this
the SonoCiné.
interesting. So how would you say, so you've described a little bit, well, maybe just walk us through like what can you expect when you get one of these scans? And let's compare it to a traditional mammogram. Let's compare the two and tell me a little bit about how they're different.
Great question. So the traditional mammogram is super barbaric. You lay down or you're sitting and you put your breast in between two plates, you smash it, you compress it, and you radiate it.
Right.
So, nothing about that seems natural, in my opinion, especially if you have something called dense breast tissue. 50% of mammograms are missed in dense breast tissue.
Mm,
And that's because it's like if you have a little tumor inside of your breast tissue, it's a snowball. And under the mammogram images, it's already white. So, it's like looking for a snowball in the snow. 50% missed. You just
wow.
can't see it. If you have fatty breasts, which is women who have larger breasts, it's easier to see because
Mm,
the cancer will show up because the fatty tissue looks black and the cancer will show up as white.
mm,
But women like me who are, small to medium sized breasted,
right.
just we are risking going to this appointment and just getting results and we have no idea if something was there. So you have to put the control in your hands. I highly recommend doing ultrasound for everyone, dense breasted woman and fatty breast woman, because there's no radiation
Mm-hmm.
and it can see through the tissue. It penetrates deep enough that it can detect super, super small tumors, God forbid if there is something. That way, when you detect tumors small, you don't have to do aggressive treatment. You don't want to wait until
Right.
it's too late.
Right.
So that's where ultrasound comes in. Early detection, no radiation. It's super safe for your tissue. There's no pain, there's no smashing, there's no contrast agents, and there's no guessing.
Right.
With the mammogram, to be honest, 1 out of 10 women get called back because of something that was questionable, and there's tons of biopsies done. There's tons of aggressive
I
treatments
went down
done.
that road right here.
Yeah.
Yep.
And 99.9% of the time, it's benign.
Right. I remember that journey. I mean, it was a couple years ago, and I found a lump and went in, and it was mammogram. Wait, now you need to go get ultrasound. Wait, now you need to go get an MRI. Wait, now we need to do a biopsy. Wait, now we need to look at the other side too. I mean, it was like between my schedule and all the like, we need this and we need this. It was 6 months.
Yeah.
At the end of that 6 months, it was benign. It was normal.
Yeah.
So, personally, to be 100% honest, even I am like, is mammogram really the right tool as the initial step, And then and this is just being completely transparent, when we go to order ultrasound for our patients. We're like, okay, you have dense breasts, and we do need to talk more about dense breasts. But we go to order, ultrasounds, breast ultrasounds on our patients. The radiologist and the imaging facilities, at least, in some of the areas where we have our clinics, are refusing to do that. They refuse to do an ultrasound unless you do a mammogram first. So it leaves, the patient, the woman, so confused and like, okay, I have to do this mammogram and I have to go down this journey again and again, especially when you're telling me that 1 in 10 women get called back.
Mhm.
To me, that just seems like such a problem. Why do you think we've set the system up that way?
So basically, they want you in the system. If you think about it, they want you to go do the mammogram because the mammogram makes money. Then they want you to go do the ultrasound because that makes money. And it's they want you in the system. In my opinion, the ultrasound detects more cancers than the mammograms. That's a fact that it's detecting 50% more cancers. Maybe I question. I'm like, maybe they don't want to find
An early
an early
cancer.
cancer because the treatment of chemotherapy and all that aggressive cancer makes money.
I hate to believe that.
I know, but why is it so hard to get an ultrasound? I don't understand.
It is ridiculous.
They won't do it.
It's ridiculous. It's
Women,
beyond
and
ridiculous.
that's where SonoBreasts was created, a place where women do not need a prescription. They do not need a doctor's order. They put their health in their own hands. They call our clinic, they come, they get scheduled, and they get results within 48 hours. That's it.
That's incredible. I mean, I was trying to schedule mine
Right.
this trip. I told you that, and I just couldn't get the timing to work out, but I'll be back, I promise. But, I just think we make things too hard for women to be advocates of their own health. And I think in an area as sensitive as breast health, I feel like it's super exciting that there's new technology, old technology not ever used, coming out into the market so that we have more options. I think it's incredible. What's the difference, though, between the SonoCiné, I hope I'm saying it right, and a traditional breast ultrasound? Is there a difference between those two?
Yeah.
Tell us about that.
So the traditional breast ultrasound, once again, there could be human error because the technician
Because
is
you're
like
holding the probe.
holding the probe,
Okay.
and you're guessing and driving. It's like texting and
Texting and
driving.
driving. I
Yeah.
love that analogy.
Yeah, it's
I
like
was like,
texting and driving.
I don't want you texting and driving on my breast. Please
Right.
stop. But anyhow.
Exactly. So, if a patient has larger breasts, you just want to you really need to have a good sonographer. If you have a sonographer that's not trained, something can be missed because we are the operators.
So it's like taking the human error and the human component out of it a little bit.
Correct.
Okay.
Correct. It's just, and it records the 3,000 images and it compiles it into a 3D movie.
So when you go in for one of these scans, are you laying forward, like face forward? Or you face up?
You're
What?
faced up supine, just like a
Okay.
regular ultrasound.
Okay.
And then I'm just holding the probe, and the probe is sweeping the 3,000 images.
Okay. Gotcha.
Yeah.
Excellent. What kind of results have you seen? What have you found? What have you seen? Because how long have you guys been offering this technology now?
So at my clinic for 6 years.
For 6 years.
Yes.
Tell us a little bit about the patient experience and what you found and what, some of your patients are saying.
Yeah, so during the pandemic, I had a client, she was 24 years old. She had a lot of breast pain, and her OBGYN, I don't know why, referred her to get a mammogram. I mean,
Mhm.
at 24 years old,
Mhm.
why would you radiate a 24-year-old girl's breast tissue? I think that's too young. I don't know why they're not going in straight for an ultrasound. And because if you do enough of that radiation, in my mind, it will cause the cancer.
And many experts agree with you today that mammograms are playing a role in the incidence of breast cancer as
I
well.
agree. I
Yeah.
mean, 1 out of 3 are getting breast cancer.
Yeah.
If you start thinking about what causes it, radiation can be one of them.
Right.
And she went in for her mammogram and it was normal. She had a lot of breast pain to the point she was waking up in the middle of the night to take Advil.
Mm.
And the doctor said it's fine. It's hormonal. It's, you're in your ovulation phase. It's, it's normal.
Right.
She found me on Instagram, and I think I posted a post about breast pain and how it's really important to not ignore pain.
Right.
It could be
Which I
something
agree with.
more
100%.
serious.
Yeah.
It's not always hormonal. It's not always your moon cycle. And she came to my office during the pandemic, and I found the cancer. It was literally 2 millimeters. It was so
Tiny.
tiny. And our radiologist came into the office. They did a biopsy, and she literally says it's the best thing that it's ever happened to her because now she's like a health cancer coach.
Oh, wow.
Yeah.
So with that tiny cancer, that's enough to experience pain?
Yes. She
Wow.
was young. It was affecting her maybe more than other people. Everybody's body has different
Right.
reactions.
And she didn't need any like chemotherapy
Nothing.
because it was so
It
small,
was so
so
small. She
localized.
just had a
Yeah.
lumpectomy, and now she's working with one of the most famous cancer doctors, and she says, "God gave this to me for a reason. It was my purpose to help other women, guide them." So now she's always talking about ultrasound, and she's always talking about how early detection can save your
It
life.
really can. And I think, one of the things that we have to be aware of, we have this general recommendation of getting breast screening at age 40, but the incidence of breast cancer is actually skewing younger and younger. We know that women in their 20s and their 30s are also getting breast cancer, and it's a problem of the modern age. But then you're telling them to wait till 40 to get a mammogram. So the ability to go in and get something like an ultrasound, I think is incredible. Are you seeing more, young women aware of kind of the increasing risk and coming in and asking for these scans?
I have never picked up this much cancer in my life in younger women.
Are you
I
serious?
actually am picking it up more in younger women than in older women.
Stop it. What's
Yes,
happening?
something is happening. I personally think a lot of these women have had IVF treatment. That's what they're telling me. And this tumor started to grow after
The
the
IVF
IVF treatment. So that's one thing that I'm hearing from the clients that
from
are
the
coming, from
patients,
my
right?
patients.
Right.
Yeah. And that's really common right now. A lot of women in their late 30s and 40s after IVF. Another thing that's, environment, your environment is a big
Right.
proponent.
Huge.
It's huge. So stress, I'm sure
Yes.
causes inflammation in your body and suppresses your immune system. So I think people are just way more
Too
stressed
stressed.
these days, especially the younger generation.
Are they coming and telling you that they're stressed
Yeah.
or reporting that? Okay.
Yeah. I mean, the ones that we do find out that they do have the cancer, we kind of, I'm a woman, I
Right.
care.
Right.
It's like my
I
sister.
know. Right.
Yeah,
Yeah.
so I kind of hold space and I always do, ask questions. A lot of them are having trouble in their relationships. They're having
Mm.
trouble at work, just too much pressure on them. They don't have time to exercise. They're not eating correctly. So it's just a soup of inflammation, and your body can hold all of these stressors.
Interesting. Why do you think so you don't think the older women, the women like in their 40s and 50s, you're not seeing as much in them? Are they not coming in or what do you think is happening there? What do you think the difference is between the younger demographic and the more middle age or slightly older demographic?
The older demographic, they're coming in too, but I think the older demographic maybe just they have more tools,
Mm.
you know?
Yeah, totally. Yeah, we're more aware.
You're more aware, you're more grounded. The everyone is just having a spiritual awakening right now. I think people are waking up to the no drinking culture,
Yes. Yeah.
which is huge right now. Taking care of your mental health is number one in my book because just being around women's health for 13 years, the ones that kind of are in tune with their mental health, they're thriving.
Do you think that's the biggest determinant you see?
Hmm.
So fascinating to me because I'm trained in Chinese and Ayurvedic medicine and some of these older systems of medicine. And I've shared this before, so definitely not trying to bore anybody. But in Chinese medicine, the liver meridian runs through the breast, like right physically through the breast and down to other areas of the body. The liver meridian in the liver is where you store anger and grief. Now, if you extrapolate that to the hormones, right? I talk a lot about hormones and we can get into that as well. But the hormone associated with the liver is cortisol, which is the stress hormone. So it's almost like no matter which angle you want to take, if you take a Chinese medicine angle and say, okay, trauma in your relationships, trauma in your life, excessive stress that you don't have outlets to relieve, whether it's work or elsewhere, and you're storing that, right? Physiologically, in a lab, I'm going to see high cortisol, but from a Chinese medicine perspective, they see liver meridian imbalance. And over time, they believe if that's not corrected, you're going to have an issue with your breast because it sits right there. So, what you're observing through scanning is very much what older systems of medicine talked about thousands of years ago that we lost in sort of this sort of technique of, okay, just do mammograms at 40 and nothing else is important, right? Like all these other factors are not important. But to this day, I still see patients, and to this day, if a woman comes in and tells me and she's getting divorced, or she's experienced a really big loss, or something major has happened in her life, I can almost clock it. And 18 months later, oftentimes they're having an issue with their breast, or get a diagnosis of breast cancer or something along those lines. So to your point, like the stress and the cortisol and trauma are important ideas in this conversation. But I think I'm still really bothered by the younger women coming in, and you're finding it more. I'm still really like, just that boggles my mind. What would you tell a young woman if she's watching us today? What would you tell my 17-year-old?
Definitely pay attention to how you're feeling and don't ignore it. If you're having a sad day, bring out your journal, release, instead of suppressing, because most of us want to just hide it under the carpet, hide it under the carpet. I'm strong enough. I got this.
Right.
Release those emotions. Like as a 17-year-old, how do I feel today? What makes me feel good? What makes me feel uncomfortable? Another really important thing is like self-regulation, being able to feel, trust your intuition. If
That
you're
keeps coming up.
Trust your intuition. If you're having a sad day and you need to talk to somebody, fine. If it's not your mom, ask for a therapist. You need to have a backbone so you don't feel lonely. Community is important, especially
Absolutely.
for a 17-year-old. You want her to feel safe. You want her to feel nourished. You want her to feel seen and have a voice. And if a 17-year-old doesn't feel safe and doesn't have a voice, then her throat chakra is blocked.
Mm-hmm.
She's in fight or flight. Her cortisol is increased. Her hormones are all over the place. Her inflammation's high. So it's just being in tune and having an outlet to release and have a voice. I think I would tell your 17-year-old daughter.
Would you have teenagers and women in their 20s come in to do the scan?
I do.
Do they come through?
They come through. I mean, 40 years old to get screened at 40 is 20 years behind in my
I
book.
agree. I could not agree. It's almost like the bone scan thing too. It's not approved till like 60 or
I don't
65. It's
understand.
like,
And
what?
OBGYNs are not having this discussion with their patients. They say, wait until you're 40 to get a mammogram.
Right.
But breast cancer is so high, and statistically, it's 1 out of 3 women. So why not get a scan that doesn't have radiation? We use the same technology to scan women that are pregnant. Why is everyone so worried about the pap smear when you're 18 and
But not worried about the breast.
but not worried
Good
about the
point.
breast? And
Good
cervical
point.
cancer is so low,
Right.
but breast cancer is so high.
Such a good point. We have to change that.
We have to change that.
This
And
is ridiculous.
it's ridiculous,
Yeah.
and it's like, have this conversation with your patients.
And I would say for the moms listening, have this conversation with your daughters.
Absolutely.
And if you're a big sister like me, have this conversation with the younger women in your family.
Yeah.
I think this is an easy tool for us to like sink our teeth in. The only problem being, like for many people, because we face this in our clinics, like, okay, I'm going to go do it. And then the imaging centers themselves are saying, no, you can't do it until you have a mammogram. So now in the Atlanta area, we're down to 1 or 2 imaging centers that are willing to do it without a mammogram, willing to do any ultrasound. We don't have a SonoCiné, but not, willing to just do a basic breast ultrasound without a mammogram. So then we're saying all this before, the person out in the field, so to speak, their options are so limited, so.
That was my fuel with SonoBreasts. I had a really good friend. Her mom's brother owns radiology centers all over LA.
Mhm.
She went to every single mammogram appointment every single year. And she was very small breasted, like A.
Mhm.
And no one did an ultrasound on her. And her brother owns all these radiology centers.
Right.
No, the radiologist should have recommended it. I think it's their responsibility when they're reading the images. If you see dense breast tissue on the mammogram pictures,
Get an
request an
ultrasound.
ultrasound.
Right.
They didn't. She had cancer and it was missed for like 5 years. And unfortunately, she passed away in her 40s.
Oh my goodness.
Yes.
Ugh.
And it happens over and over again because by the time the mammogram will detect it, it's already been there for 10 years. Cancer starts literally the size of a seed. By the time you feel something in your breast, it's been there for 10 years.
Mm.
It starts off as a couple of cells. So once again, you can't trust all your doctors. You know, I always say when you choose your practitioners, choose it like you're dating somebody.
Right.
The way we're all so picky with our love partners.
Right.
Choose your doctor the same exact way. Do they ask about your health? Do they ask about your breast health? Do they ask about your emotional health, your diet? These are big factors of your health.
Definitely. Let's revisit the dense breast component of the conversation. Not to overshare, but I have dense
Yes.
breasts, and that's why I think I ended up down that journey. I think it's in our family. You know, we test and practice. I know I have COMT, which is that gene that makes you hold on to estrogen and store estrogen. So I talk a lot about estrogen dominance. It's a part for me, dense breasts are a part of this concept around estrogen dominance, meaning you're holding on to estrogen, you're storing estrogen, you can get lumps and bumps and cysts and fibroids and all the different things. If you know you have dense breast, first of all, what are dense breast? I know they're now officially classified, which I think is good. They weren't even classified up until about a year or two ago. But if you do have dense breast, you know, what should we be looking for, thinking about? How does that differentiate from somebody without it? Give us a little bit of your perspective there.
So I think like 80% of women have dense breast tissue.
So the majority.
Majority, yeah. Dense breast tissue, all it means is you have more breast tissue in your breasts compared to fat.
Mm.
So that's all it means. And actually, dense breast tissue, I feel like is a good thing because our boobs are more perky. So
Hmm.
if you
There
have
we go.
yeah. So if you have fatty breasts, they're usually larger and they droop down and there's more fat. There's
Mhm.
nothing wrong with having dense breast tissue. I have clients that are like, what can I do to get rid of my dense breast tissue? I'm like, all it is breast tissue. God put
Mhm.
it there for you to have beautiful breasts.
Yeah.
You know, it's just more perky. And with dense breast tissue, since we have more breast tissue compared to fat, you just have to do the right screening modality once a year, or if you're BRCA positive, maybe 2 or 3 times a year. That's all it means. It doesn't mean it's a disease. It doesn't mean that something bad is going to happen to you. They do say the risk for cancer is higher in dense breast tissue, but if you do the right screening test, it won't be missed. You'll find it early enough.
And there's stages now of dense breast, right? I think they
Yeah.
now grade it from an A to D, I believe. I
Right.
saw recently the radiologists are supposed to comment on that. So if you don't know whether you have dense breast or not, you
Right.
know, how can someone tell? Actually, that's a good question. How can someone tell if they have dense breast?
I could just tell by looking someone at someone.
Really?
Yeah, just like size A to like mid C, I feel like
Are
is dense.
dense.
And then
Okay.
people who are extremely large, like my mom is triple D, she's fatty.
Okay.
So for me, I look at it as size.
You look at a size. So are those the two types, fatty or dense?
Yeah.
Those are the main two types.
Yeah.
So dense breast, do ultrasounds.
Do the ultrasounds. Another thing that's really important is doing self breast exams.
So many women don't do those.
Nobody does it.
I
I don't even do
know.
it.
It was like it was like ingrained in our brain. Teach your patients to do self exams, and when I ask, everyone's like, "Mm, I don't do that." They go straight to the imaging.
I don't do it either.
So we're supposed to do it. So what's the correct guideline? How often are we supposed to be doing these self exams?
So postmenopausal woman, I would say do it the first of every single month, anytime the first of the month. And then perimenopausal woman, a couple days after your moon cycle, so it's less lumpy. And I would say go in front of a mirror, look at your breasts, make sure there's no skin dimpling, make sure that there's no inverted nipple, no redness. And first, get a good look at how your boobs look. So if anything abnormal comes around your boobs, you'll know you're more in tune with our breasts. Women, we're just so disconnected from our bodies. Have you noticed that
Oh,
in your
very much
practice?
so. Very much, yeah.
We just have no connection.
Why do you think that is?
I mean, because we're in the Western culture. It's the rat race. it's all about work, work, work.
Mm-hmm.
Go to the next meeting, go to the next. Everyone is so in this rat race matrix. No one is present really anymore or in tune with themselves. Once you got to create a practice for that. And so people have just become disconnected from their bodies because they're always doing something outside of their body.
Has such an issue for so many women, and I think they really have trouble putting that into some sort of daily ritual or
Yeah.
even weekly ritual. What are some of the things you do to kind of get back in touch with your feminine, which
Yeah.
also gets you back in touch with your intuition? Because intuition, I think, is a feminine superpower, but
Yes.
so many women are cut off from it because they're in the rat race, right?
Yeah.
Just curious what you do to kind of get back in touch with that.
So I really enjoy being slow and present. That's what femininity is to me. I wake up earlier in the morning, I'll light a candle, I'll make my matcha, but I'm not like in a rush
Right.
because when you're in a rush, you immediately get into that toxic masculine energy.
I'm a toxic masculine.
No, don't worry. I I've
I'm
been
kidding. I'm like, raw.
I've been in my
Yeah.
toxic masculine my whole life, and then I went to Bali, and I had a huge spiritual awakening in
Oh my
Bali.
gosh. Okay.
Bali changed my
What
life.
happened in Bali? I have to ask. You got me there. I have to ask. What happened
I
there?
went on, like, this goddess retreat for 2 weeks in Bali, and we were just praying, meditating, doing kundalini yoga,
Yoga. Uh-huh.
breath work, and we were getting, blessed by Balinese priestesses.
Mm-hmm.
No phones, no laptops, no work. We were doing the work, inner work,
Inner work.
for 2 weeks. My voice changed. I changed. I cried a lot. I released so many like suppressed emotions because once again, as a woman, as a business owner in the matrix in Los Angeles, it's like a lot of women become masculine.
Yeah.
So on that trip, especially the land of the goddesses, that's what Bali's known for, I remembered who I was.
Mm.
I had forgotten the goddess, the inner goddess in me. I forgot who she was. And it was really sad because I was disconnected to myself. And so after that trip, I learned all the tools. I learned to be present, to be slow, to love my body, to take time for myself because being in that toxic masculine energy is not healthy.
Do you think that's a part of what's making women sick?
Yes, I do.
So then how do
And you
we
attract the wrong partner.
Yeah.
You attract the wrong partner. You operate on a totally masculine energy, which shifts your whole life.
Hmm. How would you tell women to realign? Especially again, let's talk to the younger women because they have the opportunity to make some choices,
Yeah.
right? How would we advise them to realign so they're balanced, right? They still can accomplish things, but they're not living in that space.
I would say take minimum 20 to 30 minutes a day. Wake up earlier. Wake up 30 minutes earlier. Take a journal, whatever it is you like to do. I like to write. I'm a
Me too.
writer. That's my
Yeah, me too. Yeah, love to write.
that's my free therapy.
Mm-hmm.
I bring out my journal, make a drink that you like, wear a nice silk dress or something that feels good. It could be a big t-shirt, whatever feels good. And sit with yourself, put your hand on your heart, connect to your heart, and ask yourself, how do I feel today? How does Jasmine feel today? Connect to your heart. Get out of your head, connect to your heart. Your heart has like 20,000
Yeah,
neurites.
yeah.
It's smarter than our head. The science is proving it.
Mhm.
Sit with yourself and journal. The power of writing and connecting to yourself and watch what comes up.
And your heart sits right by your breast
It's
too.
it's the heart
It's right there.
chakra is right
So,
by the breast.
okay.
Exactly. So it's just 30 minutes to connect to yourself. Check in, you know?
That's an easy tool that anybody could do
It
for
is
sure.
life changing when you check in.
Right. So, we've established that the heart is the center, right? It's the magnetic field, it's the intuitive center. It sits right by the breast. We're seeing breast cancer rates go up across the board. We're seeing younger and younger women get breast cancer. What happened to you that you were able to understand this, and connect the dots between, living this like very driven, very accomplished oriented. You're a business owner, like, you've gone to school, you know, going on that path and living that life and driving and driving and driving, but coming to the realization that this is a form of toxicity, right? This
Right.
is like living in the masculine, which we as women are not really supposed to do. And it might be making us sick. And this is really hard for me to even say these words because I am that person that is always going, 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 going with so many downloads and so much going on. But what happened to you to like have that light bulb moment?
Thank you for sharing. 2 years ago, after 4 years of starting my practice, I hit a really scary burnout. It scared me. And it's because I was in that toxic masculine energy. You just keep going and going and going, and you don't know when to stop. And as a Scorpio, I'm super controlling in my work. I want everything to be done perfect. So I am hands-on, you know? It
Mm-hmm.
was hard for me to delegate up until 2 years ago. And I crashed. It was sad. I called my therapist crying in bed. I said, like, I literally feel like I'm gonna die.
Mm.
She's like, I couldn't move my arm because my job is so um physical.
Physical,
I'm
right?
like, I this is like, I don't know what I'm gonna do. Like, I need help. And she's like, if you don't get help and if you don't start delegating, you're not even gonna like what you're doing anymore.
Yeah.
You're so passionate about what you're doing, but you need to get help. Or else this is gonna go bad, Jasmine. And at that point, I had pain in my arms. I was getting like steroid shots.
Ugh.
Like, it was like, I knew it wasn't going to work anymore. So, you know what? I sat with myself and I said, okay, Jasmine, it's time to get help. And I hired more help. I hired more ultrasound technicians. And that's getting out of the toxic masculine. It's getting out of lack.
Mm.
From lack, I was scared to hire people,
Mm-hmm. Like the
train other
minds,
girls.
right,
How
right,
about if they go copy me? How
right,
about if,
right,
it's from lack?
right.
And I let go of that lack mindset. My therapist really helped me get out of that. She's like, you're going to double your business when you get help.
Yeah.
So then I got out of lack mindset and came into this more feminine light. I'm going to train my sisters and they're going to hold space for me and they're going to help me. Maybe I'll be able to move my arms more.
Right.
So I did that and I got helped. And slowly by slowly I was able to breathe again
Oh my gosh.
and, come up for a breath of air. And I got help. And then after that, I went
To
to
Bali.
Bali on my goddess retreat. It says feminine on my fingers in Balinese because when I went there, I mean, you strip away your phone and your laptop. And as a healer, I'm always helping everybody else. When is there time for Jasmine?
Mm-hmm.
Everyone's health
Mm-hmm.
is in my hand and you get it as a
Mm-hmm.
healer.
Mm-hmm.
So for 2 weeks, I did the breath work, the yoga, the Kundalini yoga, the meditation, journaling, going in all these water temples. And I just remembered who I was.
And all of that got you back in touch with your feminine.
Yes.
For someone listening, like, what does feminine sound so bad? What does feminine feel like?
Feels so good.
It
Feels light.
it's light
It feels light and airy and just in flow.
in the flow.
Yeah.
I think it's about flow and
Yeah.
alignment. So I joke about myself all the time. I am, incredibly driven and I do a lot of different things. But I think the difference is that I feel very aligned. I feel like I'm doing work that I'm incredibly passionate about
Yeah.
and brings me a lot of joy and meaning. Now I can be better about taking time out. I want to go to Bali and do
Yes.
and do the same because I do believe that we have been trained since childhood, maybe even in utero, to be disconnected from our feminine. It's always been suppressed or abused or put down. And
Yes.
I think that we as women go on this journey of trying to run from that feeling and prove ourselves, I guess. but at the same time, we lose so much in that process of trying to prove that we can live in the masculine, you know? So there's so many lessons in what you just said. We were talking about breasts, but we are, a lot of what you just said applies to being an entrepreneur, applies to being a mom, applies to being a wife or a friend, right? You said something about lack. Can you go back there just a second
Mhm.
and explain what you meant by that? Like you were operating out of lack. What does that mean?
When I started my business,
Mhm.
so sonography is this patient's life is in my hand.
Right.
So I'm the operator.
Right.
So I was in lack because I'm like, I don't know if I'm going to find other sonographers that are as good as me. Do they care as much as I care?
Mm. It's
That
almost
was
like
the
the
problem.
perfectionist type
Yeah.
mentality too,
I
right?
mean,
Yeah.
it's like I don't go over the breast tissue once. I go over each breast tissue probably like 18 times.
Yeah.
I mean, other techs don't do that. I haven't seen it. They're just going to the next, the next, the next, the next, the next. I block out almost an hour per client.
Mm.
I'm super thorough. I don't want anything missed. I want to sleep at night.
Right.
And knock on wood, in 10 years, I haven't had anything missed because I care. That person is a mother, an aunt, a sister. I want to make sure every single inch of tissue is covered.
Covered.
So where I came from lack was like, how about if she misses something?
Okay.
You know,
So not being able to delegate because
something could be
something
missed.
could be missed. So how do you get over that? As a business owner, as somebody who's responsible for teams or for people, how do you get over that?
There is goddesses all around us, and they care as much as I care. Because once I got out of lack and I went into abundance, all these girls came into my office, and now they're all there and they care as much as me. And now when
Mm.
people call, they ask to be seen by them too.
I love that. That happens to me too. I'm like, this is great. I love
This is
this. I know. This is
great.
awesome.
So it's just our fears take control of our future. But just you have to sit with that. And it's coming from also my mom's mindset too.
Right.
She's the one who said, "Don't hire anybody.
Oh, yeah.
Don't hire
Yeah.
anybody. They're going to come and copy you. Don't
Yeah.
hire anybody." It's that
Right.
Iranian mindset, which is very similar to Indian mindset.
Indian, yeah,
Yeah,
Asian. I mean, it's a very similar mindset that to be protective and to be like, hold on to this little piece because I think
yeah.
they've come from very competitive cultures is my sense. I don't know. I wasn't raised
Very
there.
competitive.
So there is that, but like that almost does us all a disservice, quite honestly. I think
Mhm.
we do better when we work in collaboration and when we work in community and we get further ahead, just from a entrepreneurial standpoint, but from a health standpoint, we have a second to breathe. I look at the doctors that are out there and they are suffering so much today, because whether they're in the conventional system where they're just slogging it and like, seeing what you're saying, patient after patient over and over and over again, volume, 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 that is a soul robbing profession, which
Yeah.
is why so many people don't want to be doctors anymore. And when you flip it and you have a lot of people setting up their solo clinics or solo practice, like that is a lot too. That's a heavy lift and a heavy load as well. So I think we do better when we come together and we collaborate and we can kind of co-create, in the universe. And I think it helps us as women. And I think women, let's go back to just thinking about women, we were never meant to be and to live alone and to do alone. We always worked in this sort of tribal, communal situation, even with raising kids. It was like there were like four aunties and four elders and like all these people. And it was like a
Mhm.
conglomerate, right? It wasn't like, oh, I'm over here doing my thing. What are you doing over there? Oh, you gave them what? Like, it wasn't like that. It was very much it was much more communal. Now I'm sure everybody always gossiped and did all those things, right? But it was a communal culture. And I think what's happened in this modern age is as we've moved to more of this individualistic culture, it's only hurt us as women. And I think breast health, breast cancer is one of those. I think mental health is another sign of of how we as women, if we really want to have a conversation around health and wellness, then we've got to be thinking more communally rather than thinking about, okay, here's my stake in the sand and my family and my stuff, and I'm going to win, and I think that could be hurting us too.
I think that's beautiful what you just said, because that individualistic mindset can cause the disease.
Mm. And you're seeing it in the ultrasound
Oh
world.
yeah, it's the health space. I mean, I got it on my own. I can do it better than anybody
Right.
else.
Yep.
We as women need community. In the
Mm.
blue zones, the reason why they live so long in the blue zones is because of their strong sense of community. They eat meals together, breakfast, lunch, and dinner with their neighbors. They
Mm.
go exercising with their neighbors. That strong sense of community will keep your immune system even stronger.
What do the Bali priestesses say about us?
Oh, they think we're nuts.
And again, I love that they're priestesses because, again, it was always women that were the healers that
You're a
owned the
priestess,
medicine.
you're a healer. You're a priestess, you're a healer, you're a goddess. God chose you to help all your sisters. But you have to nourish and fill up your cup if
Mm.
you want to be a vessel to help the masses. You can't live from an empty cup.
Well, a part of your healing journey, and I'm wondering if you learned this in Bali or you were already doing this on your own, you practice Reiki
Yeah.
and sound baths. Can you talk to me a little bit about that? I have in my head, and we've gone in a lot of different places today on this amazing podcast episode, but there is this whole idea around vibration and vibrational energy and what that means for our health. And for me, Reiki sound bath are impacting that vibrational energy to bring us into healing. How do you connect the dots for maybe our viewers and our listeners in terms of how these modalities play into a topic like breast health and a topic like coming into your femininity?
So during that really dark phase of my life, I signed up at a place called Unplugged Meditation. It's a monthly membership where they do sound baths, yoga, meditation, because I knew I needed to fill up my cup.
Mm-hmm.
I had no idea what sound baths were. I had no idea, but a lot of people would tell me, Jasmine, you should try going to sound baths. You're always giving, go and just lay and receive. And the sound, the 528 hertz, it goes into your bones, it goes into your
Mm-hmm.
cells. On a cellular level, you're going to feel more rejuvenated. So I started going 3 times a week.
Mm-hmm.
And that's when my life also changed. I was getting downloads from God, just laying there. He would literally give me a to-do list to do, and I would follow them. And so many things
Oh my God, give me an
started
example.
to change. Sound has changed my life. That's why I went and I learned.
Ah,
That's why I learned, because I saw that so many women in my clinic needed sound and Reiki because it's such an easy practice to learn and
right.
help people.
Right. Uh-huh.
God, 2 years ago, I was definitely in the group of wrong friends.
Mm.
Wrong friends. That was, God was like, you're either going to go this way with these girls or you're going to go this way. And he came to me in one of the sound baths out loud twice, because the first time I kind of like ignored it and I went into like scared. So I'm like, I'm not gonna let go of all my friends. He came twice out loud. It was a very masculine noise, and he's like, you need to get rid of. He said both their names loud. That like
Mm.
kind of took over my whole body. It felt like I was like on a medicine journey, and I listened. After that, when God came into my, he said, you need to, and these friends were very toxic,
Yeah.
very toxic.
Yeah.
So after I listened to him, and the next day I just stopped picking up my phone on them. Imagine you're like 33 years old. I'm not 18 years old to go make a
Right.
bunch of new friends.
Right. Mm-hmm.
It's scary.
Right.
And I stopped talking to them, and my life blasted.
Mm.
I built a clinic from scratch, all these awakened,
Just from making these changes.
just making these changes. All these awakened spiritual goddesses came into my life that were high vibrational. I had space because I was like drowning with these girls, and they were
Right.
taking me with them.
Yeah.
The wrong friends can ruin your whole life.
Yeah. It's
I
like the
can,
wrong
it's
partner.
like, it's exactly the
Yeah.
same thing. It could be the wrong, same thing. And I was, they were, very mean and very judgmental, not doing the spiritual work. And I was in that group for a really long time. And I was disconnected to myself because I was
Mm.
such a hard critic on myself because
Right.
of them,
Right.
So
It's so frustrating because we know so much nowadays and we talk about these topics that I think were not talked about when I was growing up or when I was in my 20s or even my early 30s. But I see young women today, whether they're coming into the clinic or I meet them, wherever, and I still don't think they're in their bodies. Like, I still think they're disconnected from their bodies. And I still think, I would love to cut short this journey that it takes many of us till 40 or even 50 to get to in terms of self-realization and alignment and, being able to say no to people and being able to really to like live in your truth, And I think I get frustrated, that, how do we get this message to them? How do we get this message to younger women about getting back into your body? Connect, they get scared now. They're hearing inflammation's on the rise. I'm saying it along with everybody else. Inflammation's on the rise, breast cancer's on the rise in younger women. There's more toxicity in the environment, there's more autoimmune disease, there's a mental health crisis, they're hearing these messages, but I don't think women today are hearing the message of reconnect to your body to truly stay healthy. And it's just one message. And reconnecting to your body means embracing the power of your intuition to understand who the right people are, the
Mhm.
right opportunities are, who to surround yourself, who the right partner will be. Because when you're not, like you're saying, you make wrong decisions and your life takes a turn, goes this way, and it takes you a really long time to unwind from all of that damage. Some women never do. And oftentimes that is when these diagnoses show up, So I don't know. I'm just spinning here, but I just feel like if you are watching and listening to this show and there are younger women in your life, we want them to hear this message. And I don't know if you would add to any of that.
I think it's beautiful. You spoke for the both of us, trusting that intuition. I was scared to trust it because it's scary to let go of the known. But guess what? The unknown is so much better for you. God's plan is so much bigger and better for you. If you have that gut feeling that something's wrong, that's God nudging you.
Mm.
That's God nudging you. He will keep nudging you until it gets louder and louder and louder.
And the more you're in touch with yourself, the more you can hear that
Yes, you
noise.
don't want to
Yeah.
wait until it's a serious loud and something serious happens. That's what disease is too. There's nudges all the time. People always say, I knew, I knew, I knew. I
Yeah.
wish I listened.
Yeah.
Right?
They also say disease, if you look back, they also say disease is a spiritual wake-up call.
Oh,
It's
100%.
it's not a sentence the way we think about it in today's world and in, modern medicine. It is more of a wake-up call.
Yes.
And it's the call for you to wake up and get back into alignment with, whatever reason you're here and whatever it is that you
Yes.
are or you're not doing, that type
Because
of
you're
thing.
not listening.
Right.
You're not
Right.
listening.
Yeah.
And that's why that happens for you to get in touch with your intuition, to get in touch with your mind, body, and spirit, to wake up. Hey, this is not working. God will do mysterious things to wake you up. That's why we're here in this meat suit, to
Mm.
learn the lessons, to grow, to expand, to shift, to change. If it's not working, things will happen for you to wake up.
Oh my gosh. You said it so well. I don't think we could say it any better. All right. So you have the SonoCiné clinic. You're opening up more clinics,
Yes,
correct? Where do you intend to head next?
so next we're definitely going to a couple more clinics in LA. We want to go to New York. We want to go to Texas. We just want to spread this amazing option to women all over the world.
And if you could tell women one thing from your observation, one place to start, what would you tell them?
I would say start getting in touch with your body.
Mm.
Start trusting your intuition. That's God guiding you.
Ah, powerful. All right, last question. What makes you whole? We ask everybody who comes on the show that question. What fills your cup? You kind of answered it, but what fills your cup? What makes you whole? Where do you hear that voice the best?
What fills my cup? My 3-year-old niece fills my
Oh, I
cup.
love that.
Yeah. We're super close. So we have a play date once a week
Oh my gosh.
and we have so much
I
fun.
love that.
It's like we go to the beach, we go to the Santa Monica Pier, we have dance parties, we go to the beach, and that raw love, you're a mother, you understand, is a love I feel like I've never experienced before. So having that really fills my cup.
Incredible. And if someone wants to learn more about you,
People can find information on my website, sonobreasts.com, or
okay.
Instagram. They could go on my Instagram and message me if they have any questions about my journey, about the feminine energy. That's something that I love talking about because it changed me. And I would love to share wisdom and help guide women on that because that's your health.
Our breasts are a part of our femininity, and I
Yeah.
think there is something to that area being so affected nowadays. So I encourage everybody watching and listening to reach out to Jasmine, or to at least pay more attention to their breast health and get back in touch with their femininity. And if you're a young woman, get off the rat race, understand your direction, because you have a lot of amazing things ahead of you.
Yes.
Thank you so much for listening to this episode of Whole Plus. Be sure to share this episode with your friends and family. And if you haven't already, please take a moment to subscribe to this podcast on YouTube or wherever you get your podcasts. To engage with the community, follow @LiveWholePlus and check out our website, wholeplus.co. That's HOLPLUS.co for more resources and information on holistic health. See you next time.